Still, health officials say that communities should be prepared for a possible outbreak of the virus, which is likely to happen. We talked with Riverstone Health, and Q2's Jenny Fick standing by now with more on the response here in our area. Jenny?
That's right, Russ. National and local experts say it's inevitable. The coronavirus will strike here, and our local teams are already arming up.
Local health providers gathered Friday to institute something called the Unified Health Command.
Response is being directed by Riverstone Health, Billings Clinic, St. Vincent Healthcare, and Yellowstone County Disaster and Emergency Services. We have a structure that's in place to do that.
The combined response for all of these groups is centered around preparation.
CDC's sort of prediction of if it's not a matter of if, but when coronavirus Wuhan arrives in our country, systems in place for if a person comes into Yellowstone County from China who needs to be monitored. We have systems in place should someone become symptomatic while being monitored. We're currently working on looking at issues like what's our inventory of gloves and masks.
Many of those materials come out of China, causing concerns for supply.
What is our community supply of those materials, not just what each one of us has?
Currently, there are no cases in Montana. The earlier scare in Gallatin County was proven negative by the CDC. The symptoms of other seasonal illnesses are similar to the coronavirus, meaning that although those in quarantine may become symptomatic, it does not mean that those symptoms are coronavirus.
More than 96% of all the Americans who have been monitored, who developed symptoms and were tested, over 96% do not have the Wuhan coronavirus.
Belton also says it is important to pick reliable sources to reduce misinformation.
We, as a community, work through our preparedness work. We are in constant contact with the CDC and the Montana Department of Public Health and Human Services.
He says don't panic, but be vigilant. Bottom line, it is never a bad idea to be prepared.
Our bigger concern right now, quite frankly, is influenza. There are many more cases of influenza. There have been a number of people, thousands of people who have died in the United States this year from influenza. Much more present and prevalent right now. But the hygiene considerations are the same. Cover your cough, wash your hands, stay home if you're sick. And that's really what we want people to do for infectious disease in general. And I think those are sort of fundamental public.
In Billings, Jenny Fick, MTN News.
And as always, Riverstone Health reports the latest CDC news on the front page of their website. Back to you, Russ.
All right. Thank you, Jenny.